Hello, hope everyone is enjoying COPD Education Day so far. I'm Alba and I work as a nurse practitioner for Hawaii Pacific Health at the Straub Lung Center in Honolulu. Now that you've had the opportunity to learn more about the basics of COPD, thanks to Dr. Sherry Shimizu Saito, I'm here to share with you some important diseases and conditions to address and take into consideration when you or a loved one is diagnosed with COPD, or if you've already been living with COPD. These conditions or medical conditions are also known as comorbidities. And I'm going to touch upon just a few, so please note that this is not an exhaustive list, but rather some of the more common ones. And I'm going to discuss practical aspects of the conditions, mainly like the basic symptoms and initial diagnostic testing. And these are some things that you could talk with your healthcare provider and ask them if you should be screened for any of these conditions, as they can negatively affect your quality of life and cause you to have more COPD exacerbations or even increase your mortality risk. So let's get right into it. As you know, smoking is a main risk factor for developing COPD. It's also a shared risk factor for other conditions, such as coronary artery disease, which is the most common type of heart disease in the United States. This is a condition where your heart is not getting enough blood flow, oxygen, and the nutrients it needs. One of the most common symptoms that is also common in COPD is shortness of breath. And screening for coronary artery disease is dependent on other risk factors that you may have, and also dependent on your symptoms, whether you have them or not. So if you do suffer from shortness of breath and are a smoker or former smoker, or have conditions such as high blood pressure, high cholesterol, or diabetes, or certainly have a family history of heart disease, it's important to talk to your doctor if screening for coronary artery disease is right for you. And this usually starts with a simple EKG, which is a quick office test that records the electrical signals from your heart. Now, in addition to coronary heart disease, a related condition that is also seen in many patients with COPD is heart failure. So sometimes coronary artery disease can lead to heart failure, or COPD itself can also cause heart failure in certain cases. Again, shortness of breath is a common symptom of heart failure as well. And it could also cause other similar symptoms like wheezing and cough. Currently, there are no routine guidelines to screen for heart failure, but bottom line, if you have symptoms that feel like your COPD symptoms, like your shortness of breath and your coughing and wheezing, and you take your inhalers and say you take some prednisone if your doctor gave it to you, and you feel like, I just don't feel like it's working, make sure to talk to your healthcare provider and have an in-office visit so your doctor could listen to your heart and your lungs and perform a more thorough assessment to see if it's actually your heart and not just your COPD that are causing your symptoms. All right, the next condition that many associate with cigarette smoking, and rightfully so, is lung cancer. So the current guidelines recommend having a CT scan just once a year. And I know what you're thinking, oh, CT scan once a year, so much radiation. But actually, the screening CT scan that gets done on a yearly basis is a low radiation, what we call low dose CT scan. So it's important that if you are 50 to 80 years old and the key word here is and, have a 20 pack year history. Now, what is a pack year? Well, it's a way we measure the amount a person has smoked over a long period of time. And pack years are calculated by the number of packs of cigarettes smoked per day multiplied by the years a person has smoked. For example, if you've smoked 1 pack a day for 20 years, well, you've smoked 20 pack years. But if you've smoked only half a pack a day for the same 20 years, then you've actually only smoked 10 pack years. And this is sometimes difficult to calculate, especially when many people smoke irregularly. Like some people will say, oh, I smoked 5 cigarettes a day for like 3-4 years, and then I quit for a couple of years, and then I started smoking again, but a lot more, like 1 pack a day for like 10 years, and so on and so forth. So, just let your healthcare provider do the math for you. All right. Lastly, annual CT screening with a CT scan, again, 50 to 80 years old and have a 20 to pack year history. And if you are a current smoker or if you've quit in the past 15 years. So make sure you ask your healthcare provider if lung cancer screening is right for you. With the advances in technology these days, certain patients who we, detect it early and they have small, early stage lung cancer, the cure rate can be as high as 80 to 90%. And sometimes it's just a matter of surgical removal of the affected part of the lung, and you may not even need more aggressive treatment like chemotherapy. All right, so as we mentioned before, heart failure is a common comorbidities in patients with COPD. But there are other things that are directly related directly caused by COPD. And in regards to heart failure, there's one condition called pulmonary artery disease. So this causes right-sided heart failure. So your heart is, divided into your left side and your right side. And patients with severe COPD who have chronic low oxygen levels can get heart failure because of their pulmonary artery disease. But you can certainly have heart failure and not have pulmonary artery disease and vice versa. And your healthcare provider may order something called an echocardiogram, which is an ultrasound of your heart to check the structure of your heart chambers, valves, and measure the blood pressures in your heart. And that's different from the blood pressure readings that get checked in your upper arm that you're probably most familiar with. All right. Another condition that can be directly related to COPD is muscle dysfunction. And this is characterized by decreased muscle strength, reduced muscle endurance, and muscle fatigue. So it's important to stay active and get a head start on a fitness program if you already haven't done so, or ask your healthcare provider about pulmonary rehab. As you'll learn in a later presentation by Dr. Naveed Shah, pulmonary rehab is designed to improve your lung function and reduce your symptom severity. A third condition that can be directly caused by COPD is malnutrition. About 20% of COPD patients have weight loss and protein and calorie malnutrition. So eating a healthy diet tailored to your needs should be discussed with your healthcare provider. Some helpful diet hints from the American Lung Association are resting just before you're eating, or eating more food earlier in the morning, especially if you get too tired later in the day. You also want to avoid foods that cause gas or bloating, as they can tend to make breathing more difficult. Eating 4 to 6 small meals a day is important. So this helps you eat more freely. Your diaphragm moves more freely when you eat smaller meals, and it also lets your lungs fill with air and empty out more easily. Also, if drinking fluids with meals makes you feel too full to eat, then you want to limit your liquids with your meals and drink about, an hour or so after eating. And lastly, consider adding a nutritional supplement like Ensure in the evening, nighttime to avoid feeling too full during the day. And if you're a caregiver, certainly if you can, offer to help your loved one with grocery shopping or cooking. And choose foods that are easy to prepare. Because if you use all your energy to cook, you won't have enough to eat. And also make note that, quick, easy meals can be tricky because a lot of times prepared meals have high salt content. So be sure to read nutritional labels. All right, so next up, we have something that is often not always associated with your lungs, but it actually should be. So this other condition that I'm first going to talk about is something called gastroesophageal reflux disease, also known as GERD. And it's one of the most common gastrointestinal conditions in the general population. And this happens when there's a backup of stomach contents, like your stomach acid, into your esophagus, and it causes bothersome symptoms or complications. Right, many of you are familiar with the typical symptoms, such as heartburn, acid regurgitation, and dysphagia, also known as like trouble swallowing. But it can also cause atypical symptoms, and some of which are similar to COPD. And that includes, chronic cough and having recurrent bouts of pneumonia and bronchitis. And certainly patients with acid reflux also have asthma, or asthmatic patients have acid reflux. And as you can see, there are other atypical symptoms, but it's important to address acid reflux as it can increase your risk of having COPD exacerbations, and it could affect your progression of your COPD. So like if you've been taking over-the-counter acid reflux medications like Prilosec, Pepcid, Nexium, and you've been taking them on a regular basis, and your healthcare provider doesn't know, make sure you tell your healthcare provider, because you might need additional testing, such as checking for a bacterial infection called H. pylori that causes acid reflux. Or you might need something called an upper endoscopy, in which a lighted camera is passed down through your throat to look inside your esophagus and stomach and duodenum and make sure that there's no signs of inflammation, ulcers, or precancerous cells that can be caused by chronic acid reflux. All right, so next up is a familiar condition that often gets associated with being elderly and a female. However, patients with COPD can suffer from decreased bone density that leads to osteoporosis. Now, there are common risk factors for osteoporosis and COPD that overlap, and those are being, older age, smoking, being underweight, having breathing issues, and reduced physical activity. COPD also has specific risk factors for developing osteoporosis or osteopenia, and that's due to systemic inflammation, having breathing issues, using glucocorticosteroids, which many of you might know it better as, taking steroids, prednisone, and lastly, having low vitamin D levels. So it's important to talk to your healthcare provider if getting screened for osteoporosis is right for you. And this usually is done with a simple X-ray called a bone scan or DEXA scan. So if you have mobility issues, and certainly if you're on long-term prednisone or get treated with prednisone often, you want to make sure you get that checked out, because you're at higher risk for, breaking a bone if you fall or injure yourself, especially if you have, mobility issues to begin with. All right, so another common comorbidity that can also stem from chronic prednisone use, but also having COPD in general with its systemic inflammation, is diabetes. Now, many of you, if not all, are familiar with diabetes. You might have it yourself or know someone with it. But if not, here are some common symptoms. Again, some of you which have overlapping symptoms with COPD. And those include, always feeling tired, frequent urination, needing to pee a lot, have this sensation of always feeling hungry even though you just ate, or suddenly losing weight despite eating a lot. Also, always feeling thirsty, having a dry mouth, and feeling like you need to drink something. Also, for some men, sexual problems like erectile dysfunction. For women, having recurrent yeast infections, having a sore or cut that won't heal, having tingling of your hands or feet, also known as neuropathy, and also lastly, blurred vision. So again, these are many of the most common symptoms of diabetes. So if you have any of these symptoms on a regular basis, and certainly on a daily basis, talk to your healthcare provider about getting screened. And that's usually done through a simple blood test to check your blood sugar, also known as glucose level. Okay, now next up, the next condition that is often overlooked. Many times, COPD is considered only a physical condition, but its impact on mental health is just as important. Individuals who are diagnosed with COPD have a higher risk of being diagnosed with depression, especially in the first 5 years of the COPD diagnosis. And depression is not just a feeling of feeling down or sad, but depression also has other signs like trouble concentrating, feeling tired, having low energy or no energy, or having a loss of interest in things that you used to enjoy. And your healthcare provider should be screening you for depression and anxiety at least once a year, but it's important to bring it up to their attention if they don't bring it up. The quick screening we do is called a PHQ-2, which is basically, asking you, over the past 2 weeks, have you been bothered by any of the following problems? Number 1, having little interest or pleasure in doing things, or number 2, feeling down, depressed, or hopeless. If you said yes to those two questions, think about rating them. Does it happen several days in the past 2 weeks, or more than half the days in the past 2 weeks, or does it happen nearly every day in the past 2 weeks? And I want you to write that down, and the next time you go to your doctor's office, tell your healthcare provider what you scored. Because again, depression is often overlooked. And also in certain cultural aspects, it's not something that we are all open to speaking about. But this is your time to, talk to your doctor about this. Okay, the next comorbidity is anemia. And anemia of chronic disease is the most common type of anemia associated with COPD. Again, it stems from the systemic inflammation in the body. Patients with COPD and anemia are at greater risk for hospitalization and decreased quality of life and survival. And many of the symptoms overlap with COPD itself. So, and those here are here on the screen, like headache, insomnia, shortness of breath, fatigue, dizziness, difficulty concentrating, and having pale skin. But if you're dark-skinned like me, it might be hard to tell if you look pale. So you can also pay attention to like the color of your fingernails, the coloring of your tongue inside your mouth. And the other one that's also good to look at is the inner membranes of your eyelids. So make sure you discuss with your healthcare provider about doing blood tests to check for anemia. If you have any of these symptoms. And if you do, make sure that you know what kind of anemia you have, because sometimes anemia is not just having low iron level. It might be stemming from something else. Okay, and finally, the last condition I'll touch upon, and it'll be a good segue to the next presentation, is sleep apnea. On the screen, here are some symptoms of sleep apnea. Again, I sound like a broken record, but some of these symptoms overlap with COPD, but also some of the other conditions in the previous slide. So we have night sweats. Here it says bedwetting, but you can certainly wake up frequently in the middle of the night to urinate and actually make it to the bathroom. We call that, nocturia. Having sleep apnea, like observed apnea, like someone sees you actually not breathing when you're sleeping. loud and habitual snoring, and also, sexual problems too, erectile dysfunction, and also feeling tired during the day, excessive daytime sleepiness, having memory or concentration issues, waking up with a headache, or waking up with like a dry mouth or a dry throat. And also waking up in the middle of the night, suddenly choking, wheezing, having chest pain, or, gasping for air. Alrighty, so thank you for your time and attention, and I hope you found this presentation insightful and took some notes to bring with you to your next checkup. So blessings to everyone, and enjoy the rest of the presentations.